Okay, so welcome back, guys. Our next task we'll be looking at is an acute exacerbation of COPD, and welcome one more time to the Genius Class 2023. Okay, so let me share the screen with you so we can look at the presentation. So, Genius Class 2023, an acute exacerbation of COPD. In this particular case, you're an FY2 in an emergency department. 65-year-old man has presented to the hospital with a shortness of breath. Talk to him and address the concerns, or in typical ways, assess and manage the patient. So let's change here. Assess and manage the patient. Okay. And remember, this particular scenario is a talking mannequin. Yeah. So I'll write in here. Okay. It's a talking mannequin. Talking mannequin, an acute exacerbation of COPD, 65-year-old man has presented to the emergency department with shortness of breath, assess and manage the patient. So he has had a cough, green sputum, and shortness of breath for the last 4 days. Okay, he was diagnosed with COPD 14 years ago. He takes salbutamol, tiotropium, and the steroid inhalers, which is beclometazone. Okay, he has taken his usual inhalers, but there's no improvement. The opening sentence, doctor, I cannot breathe. I cannot breathe. I cannot breathe. Please help me. Okay, the setup in this particular talking mannequin, the oxygen saturation is going to find is anywhere less than 88%. Okay, so you're going to find the oxygen saturations, around 86%, 84%. Okay, temperature on the monitor 37.5, respiratory is high, 24 or above, blood pressure normal, heart rate is slightly tachycardic because it's short of breath. There are also medications on the couch, okay, or on the trolley. You're going to find the salbutamol, which is usually a blue inhaler, tiotropium, a white inhaler, beclometazone, a brown inhaler. So you're going to find some inhalers there, which are the inhalers of the patient. When you see them, it's important to ask the patient, are these your inhalers? Don't just assume as part of your, of course, assessment or history taking. Okay, so that's the setup here for us. You can see in here, there's a mild temperature, mild grade temperature, saturations are low, as I said, okay? And there are some inhalers around the patient bed. So approaching this particular task, so as we can see here, he has a shortness of breath for the last 4 days. We're going to be using an ABCD approach. So you start with A, you talk to the patient, hello, Mr. Brown, doctor, I can't breathe, I can't breathe, I can't breathe, please help me. So in this particular case, since the patient is talking, the airway is patent. You can say that since the patient is talking, the airway is patent. Then you go to B. Okay, Mr. Brown, let me look at the monitor. You look at the monitor for oxygen saturations and the respiratory rate only. Yeah, because an ABCDE, look at oxygen saturation and the respiratory rate only. You can see the oxygen saturation is 86%. Okay, in this particular case, ask the patient, do you smoke? Have you ever been told you're going to COPD? He will tell you yes. Then you're going to give oxygen. You're giving oxygen 24%, okay, using a white venturi. So I'll go back in here again, just 1 second, just to make it clear. I'm just going to write there, okay? Yeah, white venturi, okay? 2 liters per minute flow of oxygen, 2 liters per minute, yeah? Good, so that's why you're going to give oxygen 24%. Remember, we aim at saturations to be between 88 and 92%. If the saturations are within 88 to 92%, that is fine. You don't have to keep increasing oxygen because of the risk, of CO2 retention. So how we're going to give oxygen in here? Look here again. Or did I say white one? Needed a blue in the previous page, yeah, here. Blue. So I'll show you the colors in here in a second, guys. Yeah, hope you can see on the screen. So we need a blue one, okay, 2 liters per minute, yeah, in order for us to give oxygen in this case. Now let me go through all of them now in here. As you can see, these are the venturies in here. This is a mask, as you can see. So you would remove, there's a blue one in here. So this blue one connected in there, as you can see, yeah. So this blue one in here, that's a blue. You give between 2 to 4, but for easy remembering, just give it 2%, 2 liters per minute of oxygen. We'll give it 24%. Okay. If you change it to a white one, which is this a white one, then you use the 4 liters to give 80%. So our task is to start with a blue venturi. Now, how do you use it? As you can see in here, okay, this is a small tube. It will be attached into here, a small one. This bigger rounder one, you push it inside. Yeah, this side, you push it inside in there. This side, you connect to this tube. Okay, good. So it tells you different colors in here: blue, white, yellow, okay, red, as you can see, green, as you can see. But it's written on each one of them, you written how many liters per percentage. And on this mask, it's also going to tell you which color of the venturi, and the mask is written, the color of the venturi, okay, what gives you which color and what the flow of oxygen. So in this particular case, you remember we're going to work between the blue and white. Okay, so you start with a blue, 2 liters per minute flow oxygen. You look at the saturations. If they become between 88 and 92, you are okay. If it doesn't go there, then you go to what? You go to 28%, which means you change it to a white and give you 4 liters per minute oxygen. So that's how we're going to handle B, or breathing, in this particular case of COPD. The rest, after you've given oxygen to the patient, you have to look at the monitor that has gone above 88, and we need to maintain between 88 and 92. Then now you take a quick focused history. Ask the patient any fever. Look at the monitor. There's a mild grade fever, any cough, any sputum. What's the color of the sputum? Yeah, are you coughing out any flame? What's the color of the flame? When did the shortness of breath start? You know, and how long have you had COPD? What treatment on COPD? You look around and you're going to see some inhalers. When you see those inhalers, ask, are these your inhalers? Yes. What about smoking? How long have you been smoking? Because we know that COPD, of course, most of the times it's caused by smoking. Then after a quick history, then you do examinations, normal typical respiratory examination, inspection, palpation for real, percussion for real, auscultation for real, not forgetting the basis. Okay. Then after respiratory examination, what do you find? There is wheeze on auscultation. So since there is wheeze, talk to the patient, there is wheeze, I'm going to give you nebulizer. Okay. Salbutamol 5 milligrams on air. Here it is important. Okay, it's on air. Remember, in asthma, we're doing it salbutamol nebulizer driven via oxygen. Here, if you do driven via oxygen, the patient will go into CO2 retention. So it's important to say, I'm going to give you nebulizer, salbutamol 5 milligrams on air. Now, you need to change the mask. Remember, which mask are you going to use? You're going to use a nebulizer mask. So I need you to go there and change to a nebulizer mask. Okay, good. Change to a nebulizer mask. Don't start with ipratropium bromide. The first line is salbutamol. Unless the patient is not responding, then you can go to ipratropium bromide. But otherwise, give salbutamol 5 milligrams on air, nebulizer via nebulizer mask only. You should change the mask. Then you're going to say, we're going to arrange an arterial, a special blood test called an arterial blood gas. We're going to do a chest x-ray as well. Okay, chest x-ray, arterial blood gas. Then you go to circulation. You look at the blood pressure and the heart rate. They are normal, maybe slightly tachycardic. Okay. Check the capillary fill. You press on the sternum. Okay. Check the peripheries. Touch the hands. They are not warm, which suggests sepsis or cold hypoperfusion. Listen to the heart. In this case, you know it is a COPD. Just on one position on the apex is enough. Then come to the blood. Get an IV line. Send routine blood test. I'll explain. I'm going to be sending routine blood test, full blood count. UN is CRP, glucose clotting. Now, remember, speaking to the patient, you must use layman's term. I'm going to be sending some blood tests to check that you are not anemic, your liver and kidneys are working properly, check your blood sugar, signs of infection, and also arrange the tracing of your heart and ECG. Okay. Then you're going to give this patient 100 milligrams, not 200. Okay. I'm going to change it here. 100 milligrams hydrocortisone IV. Okay, so 100 milligram hydrocortisone IV as a steroid needed. Now that we have established an IV line, we're going to be giving 100 milligrams IV hydrocortisone, 100 milligrams. Okay, good. Then you go to D, disability. You have been speaking to the patient. You simply say, on an AVPU system, my patient is alert. We don't need to do a Glasgow Coma scale. On an AVPU system, my patient is alert. He wasn't drowsy. Unless the patient was drowsy, then you do the GCS. But here, an AVPU system only. Okay. Again, what does AVPU stand for? Alert, response to voice, response to pain, and responsive. Okay. Check the pupils. Find the torch, shine light into the to the eyes. Glucose, find a glucometer. They'll tell you it is normal. Review the treatment offered. What have we offered so far? We have given oxygen. We're giving nebulizer salbutamol. Okay. On air. Okay. And we have given hydrocortisone. How is the patient doing at the moment? Okay. Good. At D, we review. This is review the treatment, in particular, oxygen saturation. Okay. Here, guys, have a look. Oxygen saturation. If oxygen saturation is less than 88% and you're giving 24% oxygen, then you have to go to a 20-80% using what? The white venturi and giving 4 liters per minute. Okay, so remember that. We need to try to remember the venturi masks. Good. Then we go to E, expose. Now, let me have a look at your tummy, look at the tummy and the palpate. Inspect palpate only. Genital area, inspect, have a look for any catheters. Lower limb, look for any cellulitis, look for any DVT and palpate. Further management, explain to the patient that he has got an acute exacerbation of COPD and is likely to be some infection because he has got a green sputum and he has got a mild grade fever. So what we're going to do, we need to admit him, continue nebulizers, continue oxygen, okay, check the blood test, in particular the arterial blood gas, okay, and we're going to wait for the blood test and the chest x-ray, okay, wait for the results of the blood test, yeah, check the results of the blood test, chest x-ray, and the ECG, of course, you need a 12-lead ECG in this particular case. We're going to give antibiotics, Coamoxiclav, as long as there's no allergies. Make sure you ask allergies in your quick history, okay, Coamoxiclav 1.2 grams IV 3 times a day. If they have got allergies, then we're going to give you clarithromycin. Yeah, we go for clarithromycin if they have got allergies. And we're going to discuss it with your seniors. Thank you.